Black History Month, Colorado and Company is highlighting the voices, the stories, and creativity that continue to shape our community. When we talk about Black history, we often focus on culture, leadership, and social change, but health is such a huge part of that story. I've been following this for a long time, and I'm thrilled to be discussing this with you. With me today is the CEO for Connect for Health Colorado, Kevin Patterson, and of course, Dr. Brandy Freeman, President-elect of the National Medical Association and pediatrician at Children's Hospital. Is there anything you can't do, ma'am? So thank you so much for being here first off. Doc, I wanted to ask you to start with the history, because history plays such a big role in how people experience healthcare. So from your perspective, what should we understand about that history? And really, how does it help explain what Black families go through and what they bring when they walk into an exam room?
Yeah. No, I think one of the things that's really important when thinking about the impact of history on health today is honestly recognizing it's real.
Yeah.
You know, things happen, whether it was experimentation on enslaved women or the Tuskegee.
Tuskegee is what I was thinking, yes.
Exactly. These things really happen. And it's really limited or has restricted the trust that I think some Black families have with our healthcare system. And so it's that acknowledgement and recognizing that trust is just not given. It's something we have to earn as healthcare providers.
Yeah.
It's something that I like to think about.
Absolutely. I also think about like Black maternity rates and how that can be, I know I have a lot of friends that are going and they're saying, I want to find a Black doctor that I can understand because it's such a different percentage.
Exactly. It's that connection, right?
Yes.
Not having to explain the history, recognizing that it may be someone who already acknowledges it and kind of is going to have your best interest at heart.
Yeah, that's vital. Okay, Kevin, when you add things like insurance, cost, paperwork into the mix, taking care of your health can start to feel like very overwhelming, and you sort of want to just say, I don't want to do it, which I know people who have. So what Connect for Health Colorado, what does it do to help with that?
I think it's really just to say you're not in it alone. And so we have a lot of services that we provide directly through our call center. We work with brokers and assisters in communities. We work with community-based organizations that are partnering with us to really bring families. We try to meet them where they are. We don't create an event and say, hey, Kevin told you to come. We try to make sure we're at events that are significant and important for our community. So we'll do outreach to churches. We did the MLK Rodeo this year at the National Western Stock Show.
Smart.
There are just a lot of things where we just want to be in that place. And then they're like, hey, what's this healthcare thing? And they'll start asking us questions. And that really just starts that conversation.
And that builds the trust that you were sort of talking about, that, like, we got your back here. Okay, Kevin, what are some of the ways for Connect for Health Colorado Insurance Marketplace? It's working to make healthcare feel more understandable because it's a lot of gibberish for a lot of people, especially for families, like as you said, who are very unsure about the system or the man.
That's such a long one, Dave.
I know.
But I think it really is about understanding where people are and meeting where they are. But it's also, you know, we have a lot of information on our website. That's why we use a lot of trusted advisors if we're doing things in person, whether it's an enrollment center, we do things in hospitals, at doctor's offices. We have someone there that says, hey, you know, I've got this thing. I don't know if I have insurance. Somebody can kind of walk them through
That's what you want.
that process and help them understand. But it really is about just being part of the community and making sure that we're having this conversation that lets them know, hey, we get that it's hard.
Yeah.
These are not words you use at the holiday party. You know, nobody talks about co-insurance, pre-deductibles, all those kinds of things. So we just try to say, all right, well, what is it that you're trying to do? And let us make sure we get you the right person or the right information so you can make a good decision for your health and your family.
That was well said. And it's like a bridge, really, to the other
Exactly.
place. Okay, Dr. Freeman, as a Black woman in healthcare, you bring your professional, of course, into your own exam room, but your own lived experience, and that is so vital. Does that shape the way families connect with you?
I think it definitely does.
It has to, right?
Yeah, so whether it's, you know, I've had patients who chose me as their doctor just by seeing me in the lobby.
For sure.
And so it's one of those things that, I mean, I recognize though it's a gift, you know, and it's one of those things that I want to make sure that for my patients, I'm able to serve them the way they need to be served. So making sure I understand those connections, recognize and respect the role that they play in their health. You know, a parent is always the person who knows the most about their kid.
Smart.
And so it's really something that when I try to talk to families, connect with kids, that thinking about their experience in that room, but outside of it is part of what we're going to be talking about.
Amazing. Do you work with adults? Maybe I could.
I mean, we have a little bit of a cutoff. I don't know. Are you over 18?
I'm just 18.
Okay.
Excellent.
We'll see you
Great.
there.
Okay, good. I'll see you there. Okay. So Kevin, as we think about health as part of the Black history story, what gives you hope? This is a good question. That things are headed to the right way with access to coverage and families getting the care they need. What's the good news?
Well, I think there's actually a lot of good news. We are seeing the kinds of data points that are telling us that we're making a difference. Getting people covered keeps them alive longer. It's hard to make history if you're not alive to do it.
Good point.
So, we're trying to make sure people understand that, we're trying to get them connected to a service that lets them live a better life, lets them be around for the people that they care about. Those things I think are really important, but we're also partnering with a number of different organizations to make sure we're getting everywhere. So we can talk about Clara Brown and what she meant to Colorado, or other folks in the Yukon. They were looking to go up and really being a critical part of us expanding the American West. That is part of the history, but it's also making sure that we're getting that connection, making sure that we are there for our community, and making sure that we are able to help them live a better and a healthier life.
Unbelievable. This is, to me, you can't talk about Black History Month without talking about Black health and what that means, especially to my friends who are going through it. It just means a lot to me. So I just want to say thank you both for being here, for being such a great representation of what's going on and your insights. We know that understanding the past helps explain the present, but it also points towards what works. Like you said, trust, access, care, and it meets people exactly where they are. So if you'd like more information like I did, I want her to be my doctor, you can go to Connect for Health Colorado, visit their website at connectforhealthco.com. Thank you both for being here.
Thank you.